Thank you for joining us for today's presentation, Beyond Salary, Your Benefits and How to Enroll. Employees Retirement System of Texas, or ERS, is a state agency located in Austin, Texas. We manage benefits programs for employees and retirees of state of Texas agencies and some higher education institutions. Today's presentation is for new employees. It's designed to introduce you to the Texas Employees Group Benefits Program, or GBP for short, and review your state of Texas retirement benefits. The topics we'll cover today include your state employee benefits package and the options available in the GBP and your retirement benefits. These include the state's mandatory defined benefit plan and the voluntary TEXASAVER 401k 457 savings program. We'll also talk about designating beneficiaries and direct you to resources where you can find more information. Throughout the presentation, I'll refer to your New Employee Benefits Guide, or NEBG, which has detailed information about the topics we'll discuss today, as well as health and prescription drug plan comparison charts and monthly premiums for each plan. Pictured here is the NEBG for state employees contributing to the ERS retirement plan in green, and the NEBG for employees who work for an agency that participates in the GBP but contributes to a different retirement system in gray. Please follow along in the NEBG that applies to you. The page numbers for each reference topic is at the bottom of the presentation slides. All page numbers in green apply to both NEBGs. The state of Texas offers a comprehensive employee benefits package. Currently, the average compensation for state employees is $74,232. You may think, I'm not making $74,000 a year, but when we look at your state employee benefits package as a whole, the average employee receives a salary and benefits that equal to that amount. Let's take a closer look at what this amount represents. We see in this chart that 64.7% of your total compensation is your salary. Health insurance makes up 12.1%. This is because the state pays 100% of the health insurance premium for full-time employees. Currently, that is a benefit of $624.82 per month. The state also pays 50% of your eligible dependents' health insurance premium. That's a really big benefit to working for the state. Contributions to your retirement plan make up 6.5%. We'll talk more about retirement benefits later in the presentation. Vacation, holidays, and sick leave represent 10.3% of your compensation, and things like payroll expenses and longevity pay account for 6.5%. Now that we've discussed your total compensation package, let's look at your benefits options. Let's look at insurance benefits. We will discuss each individually throughout the presentation. Full-time employees are automatically enrolled in Health Select of Texas, a comprehensive medical and prescription drug plan administered by Blue Cross and Blue Shield of Texas. You and your eligible dependents also have other benefit options, including dental coverage, vision coverage, optional term life insurance, dependent term life insurance, voluntary accidental death and dismemberment, or AD&D insurance, short and long-term disability insurance through the Texas Income Protection Plan, or TIP, TEXFLEX, TEXASAVER. Find this list on page 3 of your NEBG. You'll want to be aware of certain dates and deadlines for enrolling in the benefits we discuss today. Let's start with optional add-on benefits. What are the optional benefits again? Optional benefits include dental, vision, and life insurance, short-term and long-term disability insurance, and TEXFLEX. Within your first 31 days of hire, you can enroll in health and optional add-on benefits, with the exception of certain TEXFLEX accounts. You can add or drop dependents from coverage. You may think, why would I drop dependents if I just started? Let's say you added your spouse, but decided a week later to remove them. Maybe they got a new job with coverage. You have 31 days to drop them. You can also make coverage changes if you have a qualifying life event. If you're enrolling a dependent child, you must complete the dependent child certification within your first 31 days, even if their coverage isn't effective until after your first 60 days. There's more to come on certifying your child for coverage. Full-time employees are automatically enrolled in Health Select of Texas effective the first day of the month following 60 days of employment. If you choose to enroll in the TEXFLEX Flexible Spending Account, or FSA, or Limited Purpose FSA, it also becomes effective at 60 days. Within your first 60 days of hire, you can also enroll in health coverage if you are a part-time employee. Part-time employees pay 50% of their health insurance premium. This is why they are not automatically enrolled in coverage. If you're a part-time employee, you need to take steps to enroll in health coverage within your first 60 days. Both full-time and part-time employees can also change their health plan or waive coverage. But again, full-time employees are automatically enrolled. Part-time employees must act to enroll. Here's an example. Maybe you have health coverage elsewhere, such as through a spouse or through TRICARE if you're ex-military, and you don't need health insurance through the GBP. You can waive your coverage, but you must do so in your first 60 days. You can add or drop dependents during your first 60 days as well. If you're adding coverage for dependents, you will have to complete the dependent child certification and dependent verification process, which we'll talk about in a few minutes. All participants enrolled in a GBP health plan must be certified as a tobacco user or non-tobacco user. The ERS benefits enrollment system defaults to yes for tobacco user status, even if the participant is a child. Make sure you've elected the box that says no if neither you nor your covered dependents use tobacco or vaping products. If you do not do this, you will be charged a tobacco user premium. So please, if you're not a tobacco user, remember to take that step to avoid the extra fee. If you or your dependent's tobacco use changes, you must log into your ERS Online account and update that status. When does your health coverage begin? As mentioned, if you're a new employee or you've been rehired and had a break in coverage, you have a 60-day waiting period before your health and prescription drug coverage begins. Your coverage will begin on the first of the month following your 60th day of employment. So for example, if you were hired January 13th, your 60th day of employment is in mid-March. Because your coverage cannot start mid-month, your coverage effective date is April 1st. If you were hired on March 5th, your 60th day of employment is during the first week of May, and your health coverage start date is June 1st. If your 60th day of employment falls on the first of the month, your health coverage begins that day. If you enroll in optional add-on benefits on your first day of employment, the coverage will be effective right away. If you make changes or enroll within 31 days of your hire date, the coverage begins the first of the following month. As a reminder, the health coverage waiting period does not apply when you're a rehire who hasn't had a break in coverage, you transferred from the University of Texas, or Texas A&M University without a break in coverage, or you're currently enrolled in health insurance coverage through the GBP or COBRA. If one of these situations applies to you, contact your benefits coordinator for more information. Now let's discuss who can enroll. You can enroll a spouse and/or eligible dependent in health with prescription drug coverage, dental coverage, vision coverage, dependent term life insurance, and voluntary accidental death and dismemberment, which includes you plus family. Check out the dependent eligibility chart on page 5 of your NEBG to make sure your dependents are eligible before enrolling them. You'll be required to certify and verify your dependents to keep them on your coverage. When you're adding coverage for dependents, you will need to complete a few simple steps. If you're enrolling dependent children in any insurance coverage, you will need to certify their eligibility. You will complete this step through ERS online when you enroll, or you can complete a dependent child certification form and return it to your benefits coordinator. You must complete this step for ERS to finalize your dependent's enrollment. When you enroll any dependent in coverage, either when you initially enroll in coverage or any time after, you must complete the dependent eligibility verification process. This process is handled through Alight Solutions, ERS's third-party administrator. When you choose to enroll a dependent, Alight will send you a letter detailing the verification process. They will let you know the names of the dependents needing verification, the type of documents you need for verification, such as a marriage certificate, and the due date to submit the documentation. If you don't complete this step, or if your dependent is found ineligible, they will be dropped from all coverage. Documentation that proves your dependent's eligibility must be dated prior to the date you elected to enroll them in health coverage. For example, Jane adds a common law spouse during summer enrollment. She'll need a declaration of informal marriage filed with the county courthouse and a current federal tax return, married, filing jointly, or joint ownership documents such as a mortgage statement or bank account statement issued within the last 6 months. This documentation must be dated prior to when she added the spouse to benefits. If she cannot provide proof of the relationship, the dependent will be dropped from coverage. Certification and verification requirements help ensure dependents enrolled in the GBP are eligible for coverage. Healthcare costs are rising all the time. Paying claims for ineligible dependents costs you and the state money. Please note, if you're adding a dependent who has previously been certified, verified, and approved, you do not have to recertify them. However, if their eligibility could not be verified, you cannot enroll them without speaking to an ERS benefits counselor. There's more information on pages 4 and 5 of your NEBG. Now that we've discussed who can enroll and when, let's take a closer look at your health insurance options. All full-time employees enrolled in GBP health insurance plans also receive a $5,000 in basic group term life insurance coverage at no additional cost. You can look at page 6 of your NEBG to review your healthcare options. Let's take a look at your health insurance options. We'll start with Health Select of Texas. Health Select of Texas is a point of service plan available to employees and their dependents living in Texas. A point of service plan simply means that what you pay for in medical expenses is determined by where you receive the service. If you stick to in-network providers, you're going to pay less. In the Health Select of Texas plan, you must designate a primary care provider, or PCP. With some exceptions, such as OBGYN care or mental health services, you will need a referral from your PCP if you want to see a specialty physician. You are not limited to seeing in-network providers, but you will pay more for services out of network. When using in-network providers, you do not have to meet an annual deductible or the amount paid out of pocket before the plan starts paying toward covered medical services. You will pay a copay and/or coinsurance, your out-of-pocket costs, for most covered medical services. The plan covers 100% of in-network preventative care when coded as preventive by the provider. The plan includes prescription drug coverage administered by Optum Rx. The prescription drug plan has a $50 annual deductible that resets January 1st each year. You will receive a prescription plan ID card that is separate from your medical plan ID card. You can get more information on prescription drug benefits on page 19 of your NEBG. Go to page 8 of your NEBG for an overview of health insurance plans. Find more information about out-of-pocket costs on page 14. Consumer-directed Health Select, administered by Blue Cross and Blue Shield of Texas, is available in the Texas service area and is made up of two parts: a high-deductible health plan and a health savings account, or HSA. You have access to the large Health Select provider network. The high-deductible plan features include, but are not limited to, no PCP or referrals are required, a coinsurance applies after the deductible is met, and in-network preventative services are covered at 100%. The prescription benefits are the same as those offered to Health Select of Texas participants, and a deductible is included in the annual deductible. Employees that enroll in Consumer-Directed Health Select will be responsible for paying all covered health expenses and prescription drugs out of pocket until the deductible is met. The deductible is $2,100 per individual and $4,200 per family. Once the deductible is met, the plan pays 80% towards covered in-network medical services and prescription drugs, and a 20% coinsurance will apply. The 20% is the amount you'll pay out of pocket. You may be asking yourself, what is the benefit to enrolling in a high-deductible health plan? High-deductible health plans are good for individuals with little to no medical expenses or higher medical expenses. Another major benefit to enrolling in a high-deductible health plan is that it works in combination with an HSA. The HSA helps you put aside pre-tax money from your monthly paycheck, so you're prepared for out-of-pocket healthcare expenses, and it can be used towards meeting the deductible. The funds are deposited into an account with Optum Bank, which is the HSA third-party administrator. You can use this account towards eligible medical and prescription drug expenses, and it will lower your taxable income. The state will make a monthly contribution of $45 per individual and $90 per family. You can also make additional monthly pre-tax contributions from your paycheck into the HSA. The IRS sets the maximum contribution allowed each year. Some benefits to enrolling in an HSA include the balance carries over from one year to the next. The funds can be kept even if you switch health plans or leave state employment. Funds can be used towards qualified medical expenses for you and your eligible dependents. And once $2,000 is accumulated in the account, the funds can be invested. If you enroll in this plan, it's important to take action and open your HSA with Optum Bank as soon as possible. Please note, ERS and your benefits coordinator cannot open your HSA for you. A general overview of the plan can be found on pages 9 and 10 of your NEBG. To get more information on your out-of-pocket, you can look through pages 14 through 18 in your NEBG. If you're already enrolled in health coverage that is as good as or better than what the state provides, excluding Medicare, you may want to consider the health insurance opt-out credit. If you elect the opt-out credit, you waive your health coverage, prescription drug coverage, and basic term life insurance. In exchange, you'll receive a credit of up to $60, $30 for part-time employees that you can apply toward vision, dental, and/or voluntary accidental death and dismemberment insurance. Please note, if you're not eligible for the state contribution toward your health insurance premium, you cannot choose the opt-out credit. This includes COBRA participants, surviving family members, or an adjunct faculty member. More information is on page 11 of the NEBG. Now that you have a better understanding of the different health plan options and the certification and verification processes you need to complete when adding dependents, let's review the optional add-on benefits available. There are two dental plan options. State of Texas Dental Choice Plan is a preferred provider organization, or PPO plan, that allows you to see any dentist you want, but you will pay less if you go to a dentist in one of two Delta Dental networks. You can use your benefits in the US, Canada, or Mexico if you live in the US. In the Delta Care USA DHMO plan, you must choose a primary care dentist from a list of approved providers, use services within the state of Texas, and use a dentist with Delta's network. Otherwise, services are not covered. View the dental comparison chart on page 24 of the NEBG to get more information on common covered expenses. State of Texas Vision is the vision insurance plan offered to employees and dependents. It is administered by Superior Vision Services. Like dental coverage, you must enroll in the plan to enroll your eligible dependents. With the Vision plan, you can get a routine eye exam from an in-network provider for $15. That compares to the $40 copay you would pay for an exam using your Health Select of Texas benefits. The plan has a large network of providers in all 50 states. Each covered participant has a $200 retail allowance per plan year to use on eyeglass frames or contacts. Copays vary depending on the type of lenses and extra add-ons you request. You can use your benefits once per plan year. This plan doesn't cover eye injuries or diseases such as glaucoma or cataracts. For these types of services, you'll want to use your GBP health plan benefits. For a list of services offered, check out the vision comparison chart on page 25 of your NEBG. Next, let's look at your life insurance options. We'll start with optional term life insurance. As we discussed, full-time employees enrolled in health coverage receive $5,000 of basic group term life insurance at no additional cost. You can purchase additional life insurance coverage by enrolling in optional term life insurance. Only employees can enroll in this coverage. It is not offered to dependents. Premiums are based on your age, salary, and the level of coverage you purchase. 4 coverage levels are available: Election 1, Election 2, Election 3, or Election 4. These correspond with coverage amounts of 1, 2, 3, or 4 times your annual salary. For some elections, you must complete an Evidence of Insurability, or EOI step. If you enroll in optional term life election 1 or 2 during your first 31 days of employment, you are automatically approved and you don't need EOI. You can choose optional term life elections 3 or 4 for coverage up to $400,000. For these elections, you must submit EOI. EOI also is required for any election if selected outside your first 31 days of employment. You can start the EOI process through your ERS online account or by contacting ERS directly. You can choose to receive instructions for completing the EOI application by mail or email. If approved, the coverage will begin the first of the month following the approval. Each election includes an equal amount of accidental death and dismemberment or double indemnity. This means the coverage doubles up to $400,000 if your death is ruled accidental by a judge. Next, let's look at dependent term life insurance. You can choose to enroll eligible dependents in dependent term life insurance. All eligible dependents are covered under one premium. The premium is $1.38 per month, regardless of how many dependents you enroll. Each dependent is covered for $5,000. The coverage doubles up to $10,000 if the enrolled dependent's death is ruled accidental death by a judge. EOI isn't required if you enroll your dependents during your first 31 days of employment or within 31 days of acquiring a new dependent through a qualifying life event, such as birth, adoption, or marriage. EOI is required if you enroll dependents outside of your first 31 days of employment or within 31 days of gaining a new dependent. Finally, let's look at voluntary accidental death and dismemberment. Voluntary accidental death and dismemberment is additional life insurance that only pays in the event of accidental injuries or death. You can enroll as an individual or include family members. Premiums vary based on the amount of coverage you choose. Coverage is available in $5,000 increments starting at $10,000 up to $200,000. EOI is not required at any time. Here are some important things to understand about voluntary AD&D. If you die because of an accidental death, your beneficiaries receive the full benefit amount. You'll receive a percentage of the coverage amount if an eligible family member dies in an accident, if there's an accident and you suffer any covered injury, or if an eligible family member suffers any covered injury. There is no double indemnity with this plan. You can find more information on pages 26 and 27 of your NEBG. Did you know that according to the Texas State Government Effectiveness and Efficiency Report, almost 1/3 of U.S. workers become disabled for at least 3 months in their lifetime? Many workers don't have enough savings to cover 3 months of living expenses. To be prepared for these unforeseen circumstances, consider enrolling in disability insurance through the Texas Income Protection Plan, or TIP. There are 2 plans available: short-term disability and long-term disability. Short-term disability provides a maximum benefit of up to 66% of your monthly salary for up to 5 months. Remember, you must use all available sick leave, including extended sick leave pool, and/or donated sick leave, or complete the 30-day waiting period, whichever is longer, before the benefit will be paid. Long-term disability provides a maximum benefit of up to 60% of your monthly salary for a period ranging from 12 months to full Social Security retirement age, depending on how old you are at the time of disability. Just like short-term disability, you must use all available sick leave, including extended sick leave pool, and/or donated sick leave, or complete the 180-day waiting period, whichever is longer, before the benefit will be paid. EOI is not required if you enroll within your first 31 days of employment. Premium amounts are based on age and salary. This coverage isn't available to family members. Please note, pre-existing conditions are subject to certain exclusions. There is a 6-month pre-existing clause. If you've gone to the doctor or you're receiving treatment for a medical condition during the 3-month period prior to the date coverage begins, disability benefits for that specific condition will not be covered for the first 6 months. More information is available on page 27 and 28 of your NEBG. With the TEXFLEX Flexible Spending Account program, you can set aside pre-tax money from your paycheck to pay for eligible healthcare and dependent care. Your TEXFLEX contribution is automatically withdrawn from your paycheck and deposited into your account each month. PayFlex Systems Incorporated began administering the program on September 1st, 2021. 3 types of FSAs are available. Maximum contributions vary for each and are set by the IRS. You can enroll in the Healthcare FSA to help pay for eligible medical, dental, vision, and prescription drug expenses. You can contribute a minimum of $180 up to $2,750 annually. Even though your contribution is deducted monthly, the entire amount you designate to set aside for the year is available upfront if needed. There are a few different ways to apply your FSA funds to your expenses. All participants receive a TEXFLEX debit card that you can use to pay for expenses at the time of purchase. You can also pay out of pocket and then upload a claim for reimbursement through the TEXFLEX website or mobile app. You can also pay out of pocket at the time of service and submit a claim by fax or mail. Remember to save your receipts. Even if you use the debit card to pay, the purchase may not be automatically verified as an eligible expense. IRS requires the TEXFLEX administrator to validate every purchase as an eligible expense. If they are unable to verify the purchase, they will ask you to provide a receipt to confirm the purchase was eligible. You can carry over $550 from your TEXFLEX account from one plan year to the next. Any amount over $550 is forfeited after August 31st. You have until December 31st of each year to submit a claim for reimbursement of eligible expenses incurred through August 31st. If you're enrolled in Consumer-Directed Health Select, you can use your health savings account, your HSA, to pay for eligible medical expenses. Because of this, you would not be eligible for the TEXFLEX Healthcare FSA. However, you do have the option of enrolling in a limited purpose FSA. The limited purpose FSA works the same as the Healthcare FSA, but you can only use the funds for eligible dental and vision care expenses. Remember, the limited purpose FSA is available only to Consumer-Directed Health Select participants. Finally, let's look at the Dependent Care FSA. This account lets you submit eligible dependent care expenses for children or adults for reimbursement. You can elect to contribute a minimum of $180 up to $5,000 annually per household into the account. Unlike the Healthcare FSA, your entire contribution amount is not available up front. Like a checking account, the money must be in the account before you can use it. The Dependent Care FSA is a reimbursement program. You have to receive services and incur the costs before you can file a claim. If you file a claim before you receive services, the claim will be denied and you will need to resubmit. You can only be reimbursed up to the amount available in your account. If your claim exceeds this amount, you'll be reimbursed for the remaining amount of a claim once money is available in your account. You cannot carry over funds for your Dependent Care FSA. However, if you don't use available funds by the end of the plan year on August 31st, you have a grace period from September 1st through November 15th to use remaining funds. Funds not used by November 15th are forfeited. December 31st is the last day to submit claims incurred through the end of the grace period. To use your dependent care FSA fund, you can upload claims through the TEXFLEX website or mobile app after incurring the expense. You can also submit a claim form by fax or email after incurring the expense. See pages 29 and 30 of your new employee benefits guide for more information. Your insurance benefits are a valuable part of your compensation. The second most important part of your state employee benefits package is your ERS retirement plan. This slide only applies to employees who participate in the ERS retirement plan. The State of Texas Retirement Plan is a defined benefit plan, or commonly known as a pension. This plan pays eligible retirees a set monthly annuity that is calculated using a formula defined by state law and based on factors like your salary and years of service. The Texas legislature also determines contribution rates for the plan. Currently, 9.5% is deducted from your pre-tax earnings and deposited into your ERS retirement account. This contribution cannot be changed or waived. The state contributes 9.5% of payroll and your agency contributes 0.5%. The state and agency amounts are deposited into the ERS Retirement Trust Fund. Every month you contribute to the plan, you get 1 month of service credit. This includes earned and purchased service credit. The amount of service credit you have plus your age determines when you'll be eligible to retire. Eligible retirees meeting the necessary criteria receive a lifetime monthly annuity and can be eligible for GBP retiree insurance benefits. You can't take out loans against your ERS retirement account. If you leave state employment, you can request a refund of your retirement contributions, but not the state and agency contribution, and any interest earned on the contributions. Be aware that funds paid out directly to you are taxed, and depending on your age, you could have an additional penalty when you file your taxes the following year. If you withdraw your contributions, you lose the earned service credit. This means you will not be eligible for the retirement benefit unless you start working and contributing to your state retirement plan again. More information is on page 32 of your NEBG. This slide applies only to employees who participate in the ERS retirement plan. You can purchase service credit to potentially increase the amount of your annuity or retire sooner. There are different types of service credit you can purchase, such as refunded service credit, military service credit, waiting period service credit, and additional service credit. In most cases, the earlier you purchase service credit, the less it will cost you. If you're considering purchasing service credit or would like to learn more about it, there are several resources available. You can view more information on pages 33 and 34 of your NEBG. You can also view the service purchase presentation on ERS's website. To get an estimate of how much it will cost to purchase your service credit, you can call ERS or visit the ERS website and search Service Purchase Request for active employees. You can boost your retirement savings through the TEXASAVER 401k 457 program, a voluntary retirement savings program administered by Empower Retirement. Financial advisors suggest the average person needs 80% of their pre-retirement income to maintain their lifestyle in retirement. Your ERS annuity alone may not provide the income you need. Think of your retirement as a three-legged stool. One leg is your monthly ERS annuity. The second leg is your Social Security Administration benefits. And the third leg is a personal savings or retirement account like a 401k or 457 or other savings. All three legs are needed. Because it's so important to save for retirement, new employees are automatically enrolled in the TEXASAVER 401k plan. 1% of your salary is set aside pre-tax in this savings account. You can increase, decrease, or stop your contributions at any time and change how your funds are invested. You can transfer money from a qualified retirement account from a previous employer to maximize your savings with TEXASAVER. Please note, program availability may differ for some higher education institutions. To learn more about managing your TEXASAVER account, you can view one of the presentations available through the TEXASAVER website or contact Empower directly at 800-634-5091. More information is available on page 35 of your NEBG. While you don't necessarily need to designate your beneficiaries within your first month of employment, it's important to do so as soon as you can. If you're participating in the retirement plan, once you've made your first contribution, log into your ERS online account and designate your beneficiaries. You can log into your ERS online account to designate your life insurance beneficiaries once the coverage is effective. You'll need to create a profile for your beneficiary. This requires their legal name, social security number, date of birth, and mailing address. To designate beneficiaries for your TEXASAVER account, you'll need to download a form from the Empower Retirement website and return the form to Empower. You can update your beneficiary or beneficiaries at any time as needed. Consider updating beneficiaries if you marry, divorce, and/or have children. Here's something you'll want to check out. All state employees have access to the Discount Purchase Program. Shop online and buy products and services such as computers, appliances, vacation packages, and more at discounted prices. Visit ers.savings.beneplace.com and click on the Active Employee button. There is no enrollment period or membership fee. Just start shopping and save. The program includes a simple registration step. Just enter your email address and create a password. You'll receive a confirmation email to complete your registration. We've covered a lot of information today. You can refer to your NEBG or any of the following resources to review the information we've discussed or get answers to any questions. If you need help enrolling in coverage, contact your agency benefits coordinator. If you work for an HHS agency, you'll contact the HHS Employee Service Center at 888-894-4747. Health and Human Services employees of DADS, DFPS, DSHS, HHSC. You can log into your ERS online account and enroll yourself and your dependents in coverage and designate your beneficiaries. You can also contact ERS toll-free at 877-275-4377. We're open Monday through Friday, 8 a.m. to 5 p.m. Check out our Facebook page and YouTube channels for information about your benefits. Visit ers.texas.gov to find information about your benefits, contact information for benefit plans and plan administrators, and to access your ERS online account.